A new task force developed by the State Department of Education is looking to reduce fentanyl overdoses in schools. The effort is called the School Training Overdose Preparedness and Intelligence Task Force, or STOP IT. To learn more, we welcome Dr. Holly Geyer, addiction specialist at Mayo Clinic, Arizona. Good to see you again. Thanks for joining us.
Thanks for being.
This task force, did I get it right? Is that pretty much what it's charged with doing, just getting education in schools?
It's much bigger than that. We recognize that the opioid epidemic has taken Arizona by storm. Many of our audience may not know, but more than half of the fentanyl trafficked into the United States comes straight through Arizona. We are the epicenter. And so this is also about making sure that our schools are prepared with naloxone, have policies and procedures in place, as well as the education.
If we're the epicenter, what's going on in our schools?
We don't know, and that's the scary thing. Some of the numbers that have come through over the last couple of years come from epidemiologic studies, and what we've identified is that there's more than 180 overdoses that have occurred in kids under age 18. Just in 2023, we've had 80 deaths in kids in 2021, 2022, but there's no mandate on behalf of the state schools to be monitoring how many overdoses take place. So it's really up for grabs in those numbers.
Where are the kids getting these pills? Where are they getting this stuff from?
You name it, it's out there. The entire drug trade is operationalized as a business, and so every road is marked, every street, every zip code is assigned an area for the cartels to monitor. These kids can access them just about anywhere.
So how do you convince a kid that this is lethal stuff without eyes rolling and saying, oh, there you go again?
Well, the DEA has run a great campaign. The One Pill Can Kill campaign has some good numbers on it.
Really?
Yep, we've recognized 7 out of every 10 fentanyl pills that are out there have enough fentanyl in that pill to kill the average American adult. And now these things are being stamped into things that look like standard prescription pills, Xanax, OxyContin, oxycodone. They're hard to tell apart. And now they're coming in flavored candy versions, different scent smells, targeting kids.
Yeah, social influencers are a big deal among the younger set. Is there a way to get influencers involved in all of this?
That's part of our project. As we roll this out, we hope that the educational curriculum that we develop for schools will use these social influencers to really help sell the message.
Who's on the task force?
A bunch of people. We have more than 60 representatives coming from a variety of backgrounds. We kept it multidisciplinary from a government, a Department of Education, from a medical and a behavioral health field standpoint to make sure we had diverse opinions.
Yeah, and I want to you reference this a little bit, and we've talked about it a little bit, but again, what can this task force do that hasn't already been done or tried?
Unfortunately, like many states in the nation, upwards of 30 of them, we haven't done enough. Right now, there's state legislation in place that requires schools to enact policies and procedures on the topic of naloxone or opioid overdose preparedness in schools. As to how schools have adapted that, it's been fairly heterogeneous. We've got a very large survey that's going on right now across 2,000 schools through all of Arizona. And what we're trying to assess is how many schools do have naloxone and whether or not they are prepared with education or the drug on premises to deliver to students and what the policies are. What we've learned is at least 40% from preliminary results of all schools don't have naloxone.
And that's a Narcan. That's
Narcan.
what you do. Who would be administering this, though, at a school?
We're working on policies. We have a subcommittee for that, and we aim to have at least all staff trained in Arizona schools. We'll be delivering training techniques and tools for that in an online version, so we don't miss anyone. We're probably going to work on language to make more liberal policies for students to be able to carry and administer it to without punitive damage.
My goodness. Narcan can be expensive. Who's paying for all this?
We're working on that too. We've got a subcommittee addressing it.
So the task force has its business cut out for it, doesn't it?
We are busy with a deadline of December 31st.
Really? Is there a way with a task force to actually cut the cost per dose? I mean, is that a factor that can be at play?
It's absolutely a realistic option. In fact, you would be surprised how many state and agencies, departments of health, both local and the state one, offer it for free. People can get this from libraries. There are many different options. We're exploring all of those in addition to some other ones. The Attorney General Office has disbursement funds and disbursement supplies of naloxone, and we may be looking at approaching the legislature for additional funding moving forward.
But the bottom line here is whether it's education really is the key, getting it into schools and getting the right people making the right message.
Absolutely. You know, there's a misunderstanding that if kids don't hear about it, then they don't experiment. And that's the exact opposite of what the data shows. You can reduce the risk of kids experimenting 40 to 50% by having these conversations before they look at those drugs.
Very good. Dr. Holly Guyer, again, Mayo Clinic, Arizona, on this new task. Stop It. I'm not going to read the whole thing again because it's kind of long, but Stop It sounds pretty good. Thanks for joining us.
Happy to be here.